Thank you, Madam Chair. I move to strike the last word.
You're recognized for 5 minutes.
Thank you. And I want to thank you, Ranking Member Scott, and I want to also thank Chairman Good and your staff for working with our staff. It's a collaborative moment that will benefit the American public, and I'm very appreciative. As we've discussed in the Health Subcommittee already in this Congress, lack of transparency in healthcare limits our ability as policymakers to improve the healthcare system. I was pleased to introduce the Transparency and Coverage Act with Chairman Good. This bill codifies core provisions of the Transparency and Coverage final rules issued under the Affordable Care Act, and also makes improvements so that the information is more accessible and digestible. This bill requires group health plans and issuers to make publicly detailed information regarding in-network rates, allowed amounts of out-of-network services, volume restrictions, and medical management requirements. It also requires group health plans and issuers to establish an online self-service tool that allows the real-time provision of information directly to consumers, and the bill requires group health plans and issuers to make publicly available 3 separate machine-readable files containing in-network information, out-of-network information, and prescription drug information. All of these provisions work together to give payers and consumers alike more information about how healthcare dollars are being spent. Importantly, the bill includes a provision that requires the Department of Labor to report on incorporating information regarding the ability of care alongside cost data. As we work to lower costs, it is also important that we raise the quality of healthcare, that these issues go hand in hand. The bill also includes measures to improve transparency in pharmacy benefit management. It requires pharmacy benefit managers, or PBMs, and other entities to submit detailed reports to plan administrators on a quarterly basis containing information about a group health plan's prescription drug benefit. This includes information such as the amount of rebates, fees, and discounts PBMs receive, and total gross and net spending on prescription drugs under the plan, and information regarding copay assistance programs and other discounts funded by drug manufacturers. These disclosures will provide critical insight into practices that are unfortunately notoriously opaque and can drive up costs for consumers. Before I close, I want to note that, as I've said before, promoting transparency, and I'm really delighted about how we're hearing about this on a bipartisan basis today and in the hearings, that promoting transparency and competition alone will not solve the problem of high healthcare costs. As the issue of surprise medical billing showed us, we cannot fully address market failures without more direct action to ensure our constituents have access to affordable, high-quality care. Over the past few years, Democrats and Republicans have made bipartisan progress to address these issues. In 2020, we came together to pass the No Surprises Act and the Consolidated Appropriations Act of 2021, or the CAA. These bipartisan achievements show that we can work together, Democrats and Republicans, to lower health care costs for workers and families and increase quality of care. There's still an urgent need for further action, and today we take this first important step. Again, I want to thank my colleagues. Chairman Good, thank you so much for working with us, and Chairman Fox and Ranking Member, thank you for all your support. This is a good day for American consumers.
Thank you, Mr. DeSaulnier.